Good morning, everyone. Thank you for joining us. I'm Amanda Pomeroy-Stevens, the project director for the Building Healthy Cities project funded by USAID. We welcome you to this by design platform. We are partnering with Anant National University, and this particular webinar is called Designing for Cleaner Air. It is part of our overall series of live and interactive webinars under the By Design platform, where we reach a wider range of students, community members, and professionals to generate awareness around BHC's work and Anant National University's specific take on architecture and design education. This particular series focuses on urban design and health, so looking at the interaction between these two elements in cities. And we're so happy to have our speakers here today to talk about how to design for cleaner air. A few housekeeping notes. Just remember that if you have questions for the speakers, you can put them in the Q&A. If you're having issues with your sound or other technical issues, you can put them in the chat, and our folks will try to help you along the way. We have a great set of speakers with us today. I think what we're going to do is shuffle the order just a bit and have us start with Kachina Kaula, who is joining us from Usaid mission in India, in Delhi. Kachina is an MPH and a health office senior advisor for Usaid India, where she works on digital technology, inclusive development, and other emerging priorities such as COVID-19, air pollution, and urban resilience. She's a public health professional who spent the last 20 years working extensively across India in the areas of maternal and child health, family planning, infectious disease, among other things, across 3 continents. So with that, I would like to hand over to Kachina.
Thank you, Amanda, for that introduction. I will just share my screen. Ooh. Can you see it?
Yes.
Great. So thank you very much for having me, both Anand University, the BHC project, and all of the partners who are here. It's my pleasure to be here to speak about air pollution and its health impacts, and what USAID's approach has been to address it and how we continue to do so. Let's start with what the problem is at hand. Currently, we know, and most of you on this call will know, that globally, the WHO estimates that air pollution is taking 7 million lives prematurely. We also know that this is predominantly being affected by lower and middle income countries are predominantly being affected by this, estimating about 91% of that 7 million, those 7 million people. You know, to put this in perspective for you, COVID-19 till date, last I checked, was about 4.8 million people died. And we know that TB, malaria, and HIV combined annually still does not meet even close to the 7 million. So this is a pandemic, epidemic of great proportion. We also know that there's a tremendous linkage between air pollution and climate change. You know, air pollution and climate change share the same emission sources, things like fossil fuel combustion, agriculture, waste disposal, land use change, etc. We also know that air pollution directly contributes to climate change, since certain pollutants like black carbon, ground level ozone, methane, are potent climate forcers. Or they're called short-lived climate pollutants, or SLCPs. And they remain in the atmosphere for a short period much shorter than carbon dioxide, and yet have a tremendous global warming potential. It is estimated by scientists that these SLCPs contribute to 40 to 45% of the current global warming. So what does this data tell us? What it tells us is that actually air pollution is becoming is one of the top 5 risks in health for us. It is also costing us dearly. The World Bank has estimated that the cost is probably about $143 billion in lost income. And that's an old statistic. And I believe my colleague, Richa, is going to be giving us newer statistics on this. The welfare loss ranges from anywhere from 1% in low-income countries to 5% in high-income countries. So what is the correlation between air pollution and health impact? As you can see from this slide, it affects every single piece of our bodies, right? Earlier on, 10, 20 years ago, we knew certain parts of our body were being affected by it. And today, over the last 10 years, we've built a body of evidence to show us with a lot of depth as to which parts of our body and how are we being affected by it. The original information and data really supported the correlation between PM 2.5 and all mortality, as well as lower respiratory infections, COPD, ischemic heart disease, lung cancer, and stroke. And, over the last 10 years, we've really learned that actually we even have relationships with things like type 2 diabetes, linking it with obesity. We also know that it's linked with low birth weight and short gestation. Air pollution is now increasingly being shown to be linked with cognitive issues as well, certain development, and then also neurological diseases such as Alzheimer's, and even I think one study was on Parkinson's. So needless to say, it affects our entire bodies. It starts while we're in utero and carries on right until death. Particularly vulnerable is the fetus, children, and the elderly. So where does India sit with this? If you can see, these are all statistics on very specific to India, and we're about 32% of the global burden of respiratory disease is sitting here. And we know that between 1990 and 2019, we've seen 115% increase in deaths due to particulate matter. And the question we're here for is cities, and how are cities affected by this? We link Delhi to air pollution, but as you can see from these graphs, it is not just Delhi that is affected by it. You see high levels of air pollution in both Kanpur, Patna, and I mean, Indore is in here as well. It really is across the Indo-Gangetic belt. We know that one city, for example, Delhi, there was between 1990 and 2010, the mortality was nearly doubled from air pollution. And what does this look like in a doctor's office? I take this slide from one of my favorite chest physicians who works as a chest surgeon, used to be at Gangaram, now is at Medanta. And really, when he started his practice in the late 80s, 90% of his patients that were coming in with cancer were smokers, and 10% were not. Today, that is about a 50-50. When he started, it was, 50 to 60 was the average age range. Today, it is 30 and 40. And he will routinely say to you that I see 30-year-olds walking into my clinic with lung cancer. Whereas initially there were almost no women Today, we're seeing 40% of his patients being women. And of course, he's very famous. And for those of you who haven't seen it, you definitely should look him up online for his images of the pink lungs and the black lungs and what is happening actually very visually to us. So all this new information that we've collected over the last 10 years has resulted in the WHO refining and revising its guidelines. You know, what it's really done is brought forth this idea that actually today we know much more than we did before. And with that information about what pollutant is affecting what area of health, we now see that PM 2.5's permissible limits are much lower, as is with PM 10 and these other pollutants as well. It is estimated that if we can meet these guidelines, we will be able to prevent around, I believe, 80% of the 7 million deaths that happen prematurely each year. So what's USAID's response here? In India, USAID is investing nearly $20 million towards mitigating and reducing air pollution, with a special emphasis on engaging local communities and addressing the need of the most vulnerable and marginalized. And how do we do this? You can see these 8 different avenues through which we are working towards improving mitigation and reducing exposure. And they vary. They vary from individual level behavior change to policy level engagement and action, to the science and technologies, to engaging with markets to better support cleaner air. And really, we are governed by 4 principles for this. The first being that we invest in local systems. We ensure that there is country ownership, city ownership. We have very strong and state and municipal level relationships. We expect that local partners will be increased and their capacities will be able to deliver this. And we really are building around a resilient user of the health system. The second is that we emphasize scaling. An idea, if it only sits in one town or one jurisdiction, however valuable it is for them, it defeats the purpose if it can't go beyond where it is. So we really do emphasize the importance of scale. We also maximize private sector engagement here. And we look at the private sector not just as being the resources, but also as being the proponents of technology and innovation, and believe we have a great deal to learn from them. And of course, what's near and dear to my heart, which is we put inclusive development at the center of all our programming. If we can make this work for the most vulnerable, the most marginalized, we will improve the quality of air for everyone. Our investments are here listed, and we have the Building Healthy Cities project as well, which hosts, and this is one of the maps that is in the Integrated Command and Control Center, representing what the quality of air is in Indore. So where are we taking our work in air pollution? And how are we operating here in the space of health? We see it twofold. One is that we need to engage the health machinery. Health is unique in that it sits in everyone's living rooms. You know, an ASHA, an Anganwadi worker, they are coming to your doorsteps, less Anganwadi workers, more ASHAs, coming to your doorsteps. And we need to use the millions of these women that are all over the country to engage them in this conversation. The second area we're really working with health is an excellent entry point into harnessing a social movement, particularly when it starts with concerning our children. It calls for action. And we believe that the health system and having better data around health impacts helps us to do so. Other areas we are looking at in the future is more engaging of vernacular journalists so that we can better communicate pollution and its health impacts. deepening and widening market-based regulation for pollution mitigation, increasing air pollution disclosure, data transparency, and use. It's not good enough to just have the monitors out there. It's how they're used that become important. Of course, we are a part of strengthening and execution of action plans and the learning from them, as well as trying to look at technical assistance to industries for air pollution abatement. With that, ladies and gentlemen, I will present to you the image that we all are familiar with that comes from Punjab, where you had, I think the young man who took this photograph after his 30 years saw what it looks like to have clean air because of the pandemic. It's doable, and we hope to be a partner for the government of India to do this. Back to you, Amanda.
Thank you, Katrina. That's a great setup to give people an understanding of why we're talking about this today. And with that, I will introduce our next speaker, Mr. Rishab Gupta. We're so happy to have him. He is the CEO of the Indore Smart City Development Limited. He is a 2014 batch from IAS in the Madhya Pradesh cadre. And he is currently working, as I mentioned, as a CEO for ISCDL. Indore became India's first city to earn 5 million through carbon credits, which he'll touch upon in this presentation. To achieve this, they've registered 3 projects. This includes their biomethanation plant, which is a real innovation in both waste treatment and in air quality, a compost plant, and a 1.5 megawatt solar plant under the Verified Carbon Standard Program of the UN's Framework for Convention on Climate Change. Indore Smart City is selected in the world's top 36 cities to become a leader for other smart cities by the World Economic Forum. And it has been the cleanest city in India for 4 consecutive years. To make this happen, the CEO has taken up several initiatives of the Clean India mission under Smart City. Mr. Gupta is from Delhi and has held various administrative posts in Madhya Pradesh and showed his tremendous administrative skills to convert efforts into results. He did his graduation from IIT Delhi in electrical engineering. After that, he joined the Royal Bank of Scotland and then as a software analyst in its global banking and markets division. Mr. Gupta, thank you so much for joining us, and I'm going to hand it over to you to present.
Thanks a lot, Amanda. Am I audible?
Yes.
Thanks again for this wonderful introduction. Is my screen visible?
Yes, it is. Yep, we see your presentation now.
Okay. So basically, today we shall be presenting on 2 topics. First, the innovation in air pollution monitoring that we have done in Indore. And second, the consultation model for monetization through carbon credits. So let me start with the first part, the innovation in the air pollution monitoring. So as we can see, now this is something which is very, very promising. Across the world, we are seeing that the trends of air pollution are rising. But in Indore, what we can see is that the particulate matter, the PM 2.5 and PM 10 are basically reducing, as we can see, from year 2013 to 2017. So this is a very healthy trend. And I shall be coming into the parts where I shall be discussing why this trend is there, what we can see. Coming to the second part, let us talk about the initiatives that we have taken. The first initiative led by JSI is the building healthy cities part. So we installed 20 air quality sensors. Now, two-fold approach that is very unique to Indore have been taken up. These approaches include first, the use of technology, and second, the community participation. So first, in order to choose where these air quality sensors would be placed, we chose a plethora of places so that we be able to cover all the typical places where we can see actual rise of pollution. But even in these places, we saw that pollution was decreasing as a matter of timeline. In slums, in government schools, in traffic congestions, we are seeing that yes, actually it is reducing. Now this data from all these 20 sensors and also from the pollution control board, we are collating this data in this ICCC, which we can see. This is the most state-of-the-art control and command room on which data analytics is performed by the HP company. So we have some people, some data scientists, which are actually looking at this data, making some models as we go through this presentation. And secondly, what we are doing is doing community participation. It is not a simple bureaucracy-led approach or a top-down approach. It is basically a consultative approach that we have taken up. We have involved various institutes like Indore School of Social Work. We have taken 20 volunteers from them. So all these 20 sensors are maintained by these volunteers only. So these volunteers, they not only help maintain these sensors, they are basically our agents in actively doing the IEC activities regarding air pollution. So they have some basic understanding what is the air quality data. They can easily identify sources of air pollution. Then they are going and doing interventions on field and helping us to reduce air pollution in Indore. Now coming to the second initiative. Now this initiative relates to industries. Now there are many initiatives that we have taken with respect to industries, but one particular initiative I would like to talk about is the installation of bag filters and energy recovery based air pollution control systems. Those have been installed in steel rolling mills. There are many steel rolling mills in Indore, and they were a source of real black pollution, as we can see in these chimneys. So the initial data says that there was around 700 milligram per normal cubic meters of particulate matter that was emitted before these interventions took place. So after these interventions, we have achieved the industry standard of 50 mg per normal meter cube. So this has been a tremendous achievement for us. Also, this technology has led to saving of 20% coal consumption also. So all in all, we are saving large amount of carbon by such kind of initiatives. Now coming to the next initiative, it is basically the increase in the green cover of city. Now again, I can very proudly say, whereas all across the globe, we can see that the green cover is reducing. In Indore, we are actually witnessing an increase of overall 2%. That is basically 11 square kilometers of new lungs of the city that we have created in the past 10 years. So this is one very healthy initiative. Coming to the third initiative, again, this is something what we often brag about. We are basically changing the whole localities. The dead spaces, what we can see the photo on the left, the top left, this was the initial place. It was basically in Anganwadi. Anganwadi is the early childhood care institute for children from babies of 3 years to 6 years old. So these Anganwadis have been drastically modified, and what we can see in the right side of the collage. Now this is the current position. There is no garbage, there is no methane emission. All these neighborhoods, they have been really cleaned. Now coming to the again another aspect. Now what we can see on the left, in the photo on the left, the white is basically an old sewage treatment plant which was no longer in use. So this was a dumping ground of garbage. So this has been completely transformed into a green garden. So we are basically in the process of making such green spaces all across Indore. Now coming to the way forward. We are planning to convert more such dead places. We have identified more than 125 such dead places, which we are going to convert into green spaces in the next coming 3 years. Second, we are scaling up these strategies. We are involving more and more people. We are involving CSR. We are involving industries so that they can take up such kind of project in which we do total placemaking and we basically transform the whole area. Third, Indore Smart City is working on integrated traffic management system. So what it will do is basically it will manage and analyze the routes of the buses that we take and where the pollution actually takes place, and that we shall derive with the help of the camera, with the help of the sensors that we have installed. And correspondingly merging the two, we shall devise new bus routes. And also we shall take initiatives in those bus routes so that more cleaner initiatives can be taken up. Then we are smart roads is very good initiative in which we are actually providing all the utilities underground. So the frequent digging which take place on all the roads, so those frequent diggings can be avoided, and further due to these smart roads, the vehicles, there will be less congestion and there will be automatically less pollution. Also, we are shifting from conventional power to solar power slowly and steadily. And lastly, there is a concept of free left turns. All the left turns of the city are being made free so that the congestion is reduced, and yes, we have a lower amount of vehicular pollution. So this was the first part of the presentation. So let me go through the second part of the presentation. I hope the screen is visible for the second part.
Yes.
Yes,
Okay,
yes, it is.
Okay, now coming to the second part of the presentation, this is the consultation model of eco-friendly projects. So this is a big term, I know. So what does it mean? So as we know, we are facing a big challenge in front of us known as the global climate change. The reason known to all of us include rapid industrial growth, concentration of greenhouse gases, increased energy footprint, rapid deforestation, and the change of the agricultural activities in the past 100 odd years. Now we are facing a huge consequences as a result of this climate change. What we can witness in front of us, we can see unpredictable weather patterns. We are seeing forest fires. We are seeing loss of biodiversity. The temperatures are rising. So as a result of this, when nations got together, then when the heads joined, we took up several initiatives. Major among those include use of alternative energy, bioremediation, afforestation, biomethanation, pollution control measures, reducing deforestation. So all these measures are inadequately being implemented in Indore Smart City. Now coming to what are carbon credits. So as we know, there was a Kyoto Protocol under UNFCCC in which we implemented the objectives of UNFCCC in order to reduce the greenhouse gas emission. So the major methodology that we adopted included a market mechanism so that the developed countries and developing countries can come on a common platform so as to mitigate this climate change. So what are carbon credits? Carbon credit means basically one credit is equal to 1 ton of CO2 emission or its equivalent. If we are able to reduce such kind of emission, we are able to get 1 carbon credit. It is a market-oriented mechanism. It is a certificate, basically, which developing countries can earn as a result of such kind of pro-environment efforts. Now, the best thing is, it is a tradable commodity, like oil, like share, like equity, it can be traded in world market. For example, the current price is hovering around $2. So it can be earned by any organization, like any urban body, a rural body, a government department, an industry, who all are involved in such kind of green projects. Now, what are the opportunities? Opportunities are very apparent that it is an additional source of revenue with no additional capital investment. The projects that we are already doing, we shall be earning these credits on these very projects. Second, there is a huge scope of goodwill and international reputation. Any institution which earns credits automatically gets the tag that such an institution is involved in such kind of activities which are pro-environment. Then it is a source of foreign exchange, which is a big asset for a developing country like India. And lastly, there are many projects which cannot see the light of the day because they have a shortfall in their financing mechanisms. So these carbon credits can act as the viability gap funding for such kind of projects. So now we can see the apparent. Yes, the idea is this kind of concept of carbon credits, can that concept be used to make money by bodies like smart cities, urban bodies, government departments, or even industries? So apparently we can see, yes, it can be used. So now let's look at the journey of Indore Smart City. As told in the introduction, we started to work on carbon credits around 3 years ago. We started with only 3 projects. One was the composting project of the wet waste that we collect. Second, the biomethanation of those half of the wet waste is basically used for composting. This second half we are utilizing for making methane, and that methane is being used after compression as CNG in our own buses, so that it can be used as a replacement of the fossil fuels like petrol and diesel. Thirdly, we are shifting from conventional sources of production to solar energy production. So we basically enlisted only these 3 projects in the VCS mechanism, due to which we were able to generate around 1.7 lakh carbon credits. And when we sold these credits, we got a revenue of around 69 lakhs. That basically means 6.9 million. Now, Indore was the first smart city, or rather the first urban local body in whole of Asia to bag this unique reputation. Now, in the second verification of these very projects, we got around 83 million. This huge amount of money as compared to the first amount was largely because the value of one credit got increased around 12 times. As I told, it's a market mechanism. The values keep on changing. We basically sold at that point of time at which the value hovered from 0.5 USD in the beginning to around 6 USD right now. And now we are, apart from these 3 projects, we are registering many other projects like STPs, decentralized composting, plastic recycling, LED, efficient lighting, etc. Now we have, as we can see in this slide, we have a plethora of projects. We have basically unlimited scope in this carbon credit market. We have renewable energy projects, we have energy efficiency projects, then we can do some kind of interventions in transport sector, waste handling sector, afforestation, plastic recycling, then we can do industrial interventions, we can do cattle management. All these activities are potential sources of carbon credits. Now coming to the big question. So basically what we have seen through the Indore model is that making money through carbon credits seems fairly simple. But then the question arises, why was the Indore the first city in whole of Asia to earn revenue through these credits? There should be some catch. Now coming to the catch. the entry barriers in this carbon credit market are huge. Starting, for example, for the project registration itself, we require around $10,000 just for the registration of the project. Many institutions don't have that kind of upfront money to spend on some kind of project, on some kind of mechanism for which we are not even able to foresee in the coming 1 year what will be the revenue that we shall be getting. Second, the process flow is very complex, which we shall be dealing in the next slide. Then there are multiple carbon credit mechanisms. For example, VCS is there, CDM is there, gold standard, GCC, GES. There's many standards are there. Then there are no open trading platforms. There is no New York Stock Exchange. There is no Tokyo Exchange we have. It's a very opaque market. Then the upfront charges that are involved in the appointment of designated officers, those act as auditors. Then we have issuance fees. So these high upfront charges act as entry barriers. And lastly, the carbon credit market is a very fluctuating market. So we cannot bank upon such kind of market in order to get some kind of viability gap. So these are the entry barriers. Now, as I talked about, the process flow is very complex. As we can see, there are 4 different parts to be done by 4 different entities. The part on the right side, the purple part, has to be done by the project owner. The red part has to be done by designated operational entities. The blue part has to be done by the trading entities. And the green part, that has to be done by those people, those who are involved in verification and issuance processes. So this is a really complex process which actually prohibits people to go and participate in such wonderful market. And then, as I talked about, there are many mechanisms: CDM, VCS, CER, GCC, GES, plastic credits. So this again, this complexity alone basically hinders people to come forth and participate in this market. So now coming to the big solution, as we can see, the big idea is, yes, we can make money out of it. The big problem is the process is complex and it incurs some kind of upfront charges. Now coming to the big solution, it is the consultancy model for the monetization. This consultancy model basically involves that many smart cities, many government bodies, many industries, they can come in direct contact with Indore Smart City. We shall be doing the consultancy. We shall be bearing all the upfront costs. And then after we get the money, we shall have a revenue sharing model. So basically, this model takes away all the drawbacks of this market and basically comes up with a revenue sharing such that both the parties can benefit out of it. So basically, in a nutshell, if I can explain this model. So we have a client organization. It can be any smart city, it can be any urban body across the globe. So what that body has to do, it has to identify the project with the consultancy of Indore Smart City. Then Indore Smart City shall be providing the specific formats in which the data has to be collected by the client body. That data has to be shared. The auditors will come and visit the projects. So they have to just facilitate such kind of visits. And lastly, Indore Smart City, the officials from this smart city shall be visiting the projects in order to better know the scope and potential of the future market of carbon credits in such cities. So this is basically the role of the client body. What Indore Smart City shall do, it will start the advisory on the project identification. Then the preparation of specific data formats in which we require the data shall be prepared by Indore. Thirdly, the assessment and the verification of the data shall be done by us. And then after doing everything, will identify the particular mechanism in which the project has to be registered, and then will register the project. The star on the project registration indicates that yes, this process involves bearing, basically paying some kind of upfront money, which shall be taken care by Indore Smart City. Then Indore shall be appointing an auditor for it. They will audit the project, they will validate the project, then will identify a suitable platform where we can trade the carbon credits. After acquiring the carbon credits, we shall pay the issuance fees, and then whatever the revenue that we shall be getting, we shall be sharing with the client body. This, in a nutshell, is the whole consultancy model. This again is basically
Mr. Gupta, thank you so much. And I'm just going to ask you if you have one last slide, and then we're going to have to move on.
This is the last slide. Basically, what are the benefits to the clients? There is no upfront charge to be borne by the client. There is an additional source of income for the existing projects. Then there is an increased opportunity for carbon investments. We can go and invest in such kind of projects which are more environment friendly. And lastly, together we can earn some kind of good foreign exchange, which shall be beneficial for both the participating bodies in the agreement. So this was the consultation model. So this was in nutshell, basically both the projects. First, the air pollution initiatives that we took to mitigate the pollution, and second, the consultation model that we have come up with, which shall be earning forex for both the parties in the coming times to come.
Thank you so much, Mr. Gupta, first of all, for taking time out of your busy day to join us, and for sharing such rich information on how to turn your cleaner air efforts into actual revenue for Indore. So thank you so much. That was really, really interesting. We're going to go to our next speaker, Richa. Richa Ubadui is the head of the India program for Clean Air Fund. Prior to this role, she was at Purpose, where she was the campaigns director for India. Richa has developed strategy and programs on climate and air quality since 2015, and has overseen many successful campaigns, including My Right to Breathe in Delhi and 100% UP in UP, 100% Bihar, which all promoted renewable energy. She's worked across the globe and has managed projects on conflict and disaster prevention, developing and implementing global advocacy campaigns. Working directly in air quality, Richa has developed campaigns for many relevant fields, including human rights and labor rights, women and gender equality, and child protection. She holds a master's degree in international affairs from the New School in New York. And with that, I'm going to hand it over to you, Richa.
Amanda, thank you so much. And thank you for inviting me to this really rich discussion already. Let me just share my screen. There you go. Thanks. So I think as Katrina kind of framed the issue in terms of air pollution and its impact on health, and Mr. Gupta really looked at the city level action we can take, and really just excellent example of Indore city, which is, we all know, is doing so much amazing work. So thank you so much for that as well. I'm going to talk a little bit about a recent research that we conducted looking at the impact of air pollution on the Indian economy. So before I get into it, just a quick introduction of the Clean Air Fund. The Clean Air Fund is a pretty new sort of global philanthropy that was set up, very specific, with a very single mission to tackle air pollution around the world. We currently work here in India, but we also work in other geographies around the world, which include the UK, as well as countries in Eastern Europe. And we've taken kind of these three geographies because we believe that these three geographies are lighthouse geographies, in that they can shed light into various strategies and tactics that we can deploy really quickly, learn really quickly, and be able to replicate and scale well, both in the countries we're currently working on, but also in additional geographies around the globe. Our mission is to achieve clean air for all. So it's a big mission, given that 90% of the world population does not breathe healthy air according to WHO standards. And we know that better air quality definitely leads to healthier people, as Katrina talked about earlier, and healthier planet, as Dr. Gupta talked about in terms of linking air pollution and climate. But what has been sort of less in focus, I believe, is kind of the argument around clean air leading to a healthier economy. And so with that in mind, and to really kind of understand how the Indian economy was being impacted by air pollution, we partnered up with Dalberg Consultancy to conduct an economic impact study here in India. The objective of the study was, and kind of continues to be, to really kind of make a very strong economic case for businesses, specifically to kind of mobilize the private sector here in India to take action on air quality. And we really ensured that there was a very strong buy-in from businesses themselves to be part of the study, but also really kind of use this study for policy advocacy. And so we did that by working very closely with the CII, CEO Forum for Clean Air, which essentially convenes about 50 of India's top CEOs, who are all very much committed in taking action on air pollution.
Richa, your slides are not advancing. I don't know if
there. No,
I've just,
okay. Yeah, sorry about that. So what did the report look at specifically? We looked at sort of 6 areas or 6 pathways to calculate the economic impact. And these include first sort of the labor productivity, which is, really kind of the impact of how much people were working and how much people were not working because of air pollution. I think it's sort of, it's generally more kind of easier to understand that people might not be able to show up at work because they're sick or they have to take care of other sick people in their households. But we also looked at presenteeism, which is when people do show up at work, how does air pollution kind of impact their productivity while they're at work? So really some interesting findings around there. We looked at asset productivity, so how well are assets kind of functioning, and how much kind of what are the challenges that assets are facing due to kind of high pollutants in the air. We looked at consumer footfall, which is sort of easy to understand, were people going out or not. We looked at the impact of premature mortality on the economy. We looked at health expenditure, as well as sort of non-welfare market loss, for example, people's inability to perhaps engage in activities like caring for the elderly. So in order to kind of look at these 6 pathways, we used a 3-pronged approach. These include sort of looking at the existing literature and existing kind of research out there in the world, which there are quite a bit in terms of economic impact, but not so much specific to India. So we really kind of looked at the methodology that were used around the globe and to see what we could kind of borrow. We looked at big data macro analysis. Just looking at sort of how could big data analytics could help us kind of come at this estimation. And then we also deep dived into specific sectors through surveying businesses and consumers. And again, here we partnered up with businesses themselves to do this. So just some key findings of the study is that the big message is that India is losing about $95 billion a year because of air pollution. And really the cost is sort of being borne by businesses themselves, which is around 3% of country's GDP in 2019. We know that sort of pollution claimed about 1.7 million premature deaths in 2019, which kind of equates to, I think, last year's, which we calculated around $44 billion. Dalberg also estimated that India's workers take about 1.3 billion days off annually together because of adverse effects of air pollution on their health or their family's health, which was amounting to about $6 billion in lost revenue. And that the people, the report also found that lower air quality also reduces consumers' willingness to venture out of their homes. So there's definitely sort of direct correlation in terms of people going out and engaging in economic activities. The impact of air pollution also goes beyond people. It reduces productivity and lifespan of assets. And I'll talk a little bit about that later when we get into details of which assets we looked at. So people not showing up to work, again, it's easier to understand. People are they have health impacts both personally, but in their family. And so that's people not being able to show up to work is probably one of the most kind of visible impacts of air pollution on the economy. And our report kind of found that there were about 10% lower attendance on high air pollution days, attendance of folks coming to work. And that India is losing about 0.2% of its GDP due to absenteeism. We found that most of this kind of this particular kind of absenteeism impacts a lot more on people who do physical work, so folks in construction work or for folks for food processing work. And the study also found that many workers who couldn't really actually take time off work, so they had to show up to work because of multiple reasons. And when they did, their productivity was actually getting impacted. So the concept of presenteeism, folks who are present at work during high pollution days, the impact kind of manifested in lower cognitive abilities and physical performance. It also included quicker burnout and attrition, and which all kind of led to lower productivity. So employers were also having kind of harder time in terms of hiring good talent, particularly in cities with high pollution, and in specifically industries like IT and where companies were actually losing talent to less polluted cities. Sort of the hidden cost of presenteeism then is actually very, very significant. And it is definitely sort of the most significant in high-skilled workforce who, like I said earlier, were not able to take time off work. And so what they would show up at work, but they weren't being as productive as possible. And then in terms of sort of assets and what it does to infrastructure, we looked at sort of the RE sector specifically, and we found that solar panels were about around 13% less productive as a direct impact of high pollutants in the air. And then broadly around some of the other kind of assets, IT equipments were getting degraded much faster due to SO2 in the air, which was making them more expensive because the hardware needed to be changed more frequently. Agriculture outputs were also getting impacted because they were getting damaged. Infrastructure generally, like roads and buildings, were getting impacted because of sulfur dioxide, particularly in the air. And then sort of transportation was getting impacted because of delays due to smog and low visibility days. The other kind of sort of direct kind of correlation we found was around consumer footfall, and we looked very closely at Mumbai's Lincoln Road and found that there was about 5% drop in folks coming out to the market on pollution days. And we also saw a direct correlation of kind of higher concentration of 2.5 levels, and the decreased level of kind of market activity. And we surveyed about 290,000, almost 300,000 people to get to kind of this finding. And like I said earlier, sort of premature mortality obviously correlates directly to loss of working days, and which sort of we saw that with 18% of premature deaths in India is contributed by air pollution, which was leading to 3.8 billion days of non-working days. So that's very, very significant. We deep dived into specific sectors, the IT sector particularly, and we found that IT sector was really losing its competitive edge globally because of air pollution, and that big companies were going to cities, but even countries outside of India due to pollution and not being able to really attract good talent. The tourism sector is a very interesting one as well. We see almost sort of 1% of India's GDP being lost just on the impact on tourism. It also sort of it led to sort of employment loss for about 820,000 professionals in domestic tourism alone. And this impact is sort of twofold. Either tourists decide not to travel to India or have a lot lower quality experience when they do choose to travel. So in Delhi, particularly, before people would maybe spend a week in Delhi, we were spending a lot less time in polluted cities. And then lastly, for cities, we did a deep dive in Delhi, for Gurgaon and Kolkata. And there's some really interesting kind of cost impact that we found for these cities. And I'm going to kind of add the link to the full report in chat. So please do download it. There's lots of good data that can be used for making a stronger case for businesses, but also policymakers in these cities and beyond to take action. And lastly, I would say that the report dissemination has been really successful. Again, because we partnered up with businesses themselves, and particularly with CII, we've had a lot of buy-in from big businesses who are using the findings of this report to both look internally into their own practices, but also to really be champions for action on clean air. So let me stop there. And I'm happy to take a few questions, but unfortunately I have to run a little bit earlier today. Let me add the link to the chat so people have access to the report.
Yes.
Thank you.
Please do. And thank you so much for joining us. I'm sorry that you can't stay with us till the Q&A, but really appreciate this presentation. And it's a great start for a business case to sort of make this more widely of interest to the private sector. So thank you so much for that. We have one more speaker. I know we're running a little behind, but I want to introduce my co-host for this series, and I'm going to ask her to be as brief as she can so we can have some time for a few questions later. Dr. Ashima Banker is professor and director of the master's program in urban design at Anant National University. She has been teaching and doing research for the last 13 years and has done many government programs. Her research interests include land policy and legislation, transport, spatial planning, smart cities, sustainable development, amongst many of the themes of this series. And so with that, I'm going to hand over to her to give us a few last thoughts for this webinar.
Thank you. Thanks, Amanda. And since Amanda just said that I'm a co-host for this entire series, I welcome you again. I know we're halfway through, almost done with it. But while I share my screen, I do welcome all of you who are there for the first time. We've been running this very successfully and very enthusiastically to find out solutions to many things when it comes to health in cities. So after the amazing set of presentations that we had before me, we dealt with a lot of issues, that the connection, the link between health and air pollution. Katrina kind of set the stage for everybody to present, and then Mr. Gupta, amazing work that Indore has done was really a great thing. Especially this helps me because now I exactly know where I would be taking forward to. And of course, not to forget Richa, we never looked at, there's an economic value in addition to just the health issues that also comes in attached with the air pollution. So I think that was also a commendable thing. So I'll not dig into a lot of things that are already said, but just like it's already an established fact that air pollution is the reason of many diseases. It has been also the reason of deaths across the globe. And in India, if you look at 2.54 million deaths in India were in 2017 were due to air pollution. We know the type of pollution. We are very much aware of what kind of issues are there, what are the configuration of the setup of the air components which affect. Now, this issue is even more and more grave when it comes to developing nations. Why? Because we live in congested areas. Since the finances are we still kind of developing in that sense. The densities are higher. We have sometimes uncontrolled urbanization that places. Also, since we are wanting to increase our GDP and work towards building greater economic levels, industrialization is something that kind of happens very rigorously in most of these nations. India is one such nation which have been facing this for a long time now. I'll very quickly come to the component of city design, which is also my area of practice and research. And so rather than beating around the bush, let me quickly come back to what happens in the city. So cities essentially can be designed with segregated land use zoning or mixed land use zoning. The moment we say segregated land use zoning, now that has been a typical model in many of the urban model theories. You may think that these are all theoretical models, but no, these are the models that are actually practiced in many of the cities, especially on the other side of the globe. And the concentric zone model, in which you have a central CBD in the center and then some kind of a transition zone, which will have some industry or other workplaces, and then workers' homes, and then kind of, so the more affluent people or the larger living space is a little further away from the main economic center or hub. And then there is a commuter's home that comes at the outskirts. There's also a sector model theory which leads to sectors more like piles of slices of pie, and that way we are able to again have interrelationship across different land uses while also still keeping them segregated because of the reason of their homogeneity and to make them more similar in nature and working. The third model is the multi-nuclei model, which is very, very prevalent in many of the cities across India. In addition to that, the uniqueness of Indian cities is also mixed land use. Now, if you look at the characteristics of segregated land use, it does enable us to ensure that we have compatible adjacent land uses so that there are no discrepancies, there are no contradictions happening with neighboring land uses. But it does result in longer travel distances because people would be living further away from their place of work. There are more trips that are required for everybody because things are concentrated in one areas, whether it is about economic, job locations or whatever. In mixed land use, the best part about mixed land use, in which most of Indian cities, or I would say most Asian cities, are designed, are those which enables us to create very vibrant neighborhoods. The reason the neighborhoods become vibrant because at any point of time, the spaces and those neighborhoods are not dead. It also encourages intensification of land use. And what it translates into is that our neighborhoods can now become more walkable. There is a possibility of integrating MMT smoothly so that people for shorter distances are encouraged to walk or cycle and use other MMT ways. And of course, there is also an effective and efficient utilization of utilities and infrastructure. Now, in developing nations, particularly, this is something that is very, very prevalent. India is something that most Indian cities, I would say most of them, are following that. However, whenever we are seeing the outgrowth or the sprawl outside the cities growing, we are seeing segregated land use that are coming in places. And that is where increased trips and increased private vehicle ownership and all of those things are being kind of encouraged or forced, which leads to, of course, air pollution. So what really can be done about it? Another case I would just bring up, since I'm located in Ahmedabad, I've been here for a long time, I will bring the case of Ahmedabad. If you look at the expansion of the city of Ahmedabad, the first graphic that you see, that was the Ahmedabad Municipal Corporation area in 1965. Now, beyond the walled city, the area did get the pink color that you see, those were the industrial pockets. Over time, the city has grown. From eastern side, it has even spread out to the western side. But we can see that even around those pink areas, the industrial pockets, there are a lot of residential areas which get developed. Those residential area, people are living there, but the industries which were earlier on the outskirts of the walled city, which is this thing in the center, the light orange color is the initial whole city. So these industries were earlier in the outskirts, but now they are very much inside the part of the city. As the city grows, in 1987, if you look at, there were again some industries which came out outside the limits which were there in 1965. But by 1987, they were again surrounded by residential areas. So this is bound to happen, because the industrial areas will always, even if we try and push them on the outskirts of city so that it doesn't pollute right now, there is going to be a time when there is development is going to be, especially in cities which are rapidly growing or which have a lot of urban pressures. And so the centrifugal forces are going to apply on them. So what is the solution to it? One very clear solution that I see is the case, if we look at the situation in which Greater Noida or Noida have been planned. So these are both planned cities, Noida and Greater Noida. One very clear rule that they did for their city was they restricted certain kind of industries. They restricted industries very strictly, clearly, so the industries which will be polluting either water or air were avoided in the city. And even today, if you look at, I mean, of course, there are pollution for other reasons around Noida, but industries have not been contributing to the pollution levels of what this area has. And that has been possible only because, if you can see the purple that you see here is all industry, and the way it's integrated with the residential area, it still is not an issue. So wherever there is a possibility, wherever we are designing or we are planning industrial cities or cities with industries, we can take care of that. One very direct implication of this or reflection of this is we've already, in the current budget, we have 8,000 crores worth of budget allocated for 8 big cities that will be new planned cities that will come into India. So if that is going to be there, can our cities be done in a way where we are taking care of these things? Also the windrows analysis, which will, the kind of pollution that travels from the industry to the residential area is depending on the wind, and the wind has a pattern. Throughout the year, that pattern may change and may tweak. So if we could, for every location wherever the city is being planned, if we could keep that as a backdrop, before we do the land use planning and before we allocate zones, would it not be better choice? At least we are giving more livable conditions to residential areas. The next solution that I want to bring forward is carbon sequestration. It is not something that people are not aware of. Carbon sequestration has been there for a long time now, and there are many countries and cities who have been promoting it. Ahmedabad's case, if I bring in 2018, it started with an effort to bring in 50 urban forests in the city of Ahmedabad. Today, the 43rd urban forest is being planned in the city of Ahmedabad. What has these carbon sequestration, what have these urban forests done? They essentially becomes like lungs, what Mr. Gupta was just talking in Indore, what they've done. These act like lungs, and these in a way, they purify the air, they consume or they absorb all the carbon which is coming out due to pollution, vehicle pollution and other pollutions. And the air obviously gets, changed. And we can see the direct impact when we are traveling from the city center to the city outskirts or maybe highways or the hinterland, countryside. We do see the change in the climate, and we like to go to the countryside because it is the air is much cleaner. So it's a simple logic, being that one, the activity is lesser there, and second, there is a lot of carbon sequestration. that happens in those areas. So can that be done as a mainstreaming rather than being done as an afterthought? And urban agriculture is another way of doing carbon sequestration. The next aspect that I want to bring forth is connectivity, movement and connectivity. That is one very, very important. We've been talking about vehicle being contributing to air pollution. It's estimated that roughly 30% of the air pollution is due to the vehicles in cities. How can we really reduce them? So one is definitely you can reduce the number of vehicles. It's very straightforward answer. How do we do that? Create walkable neighborhoods and mainstreaming NMT, that's non-motorized transport in city design. The moment we do that, the need for people to use privatized motorized vehicle has to reduce. The moment we reduce that, we are reducing the emission levels. And of course, if this is coupled with the provision of efficient public transport, it does make a great combination, and people for longer distances, they can use public transport. Now, it may be said that, oh, that's really not possible in every city, and public transport has its own dynamics of where it can be viable enough technically, economically, for its usage. But that can be figured out. But we can definitely create walkable neighborhoods to reduce the trip size, number of trips. The another option that we can do is alternate fuels, which has been promoted. CNG and now EV. Electronic vehicles have been something which has been the talk of the town, and things have been working progressively. Here I bring to you the case of two nations, India and US. The reason I bring
Ashima, I'm just going to give you, we're just hitting the end of the webinar, so I'm going to ask you for your favorite slide.
Yes, absolutely. So the point that I'm trying to make is that the reason why India is still not progressing with more EV vehicle ownership, we have still the numbers are less because the infrastructure that's required for EV charging is still not there. It is expected that by 2030, we will reach only 10 to 15% penetration in total. The last aspect, though not really connected directly with cities, but as it's on the regional context, the case of Delhi, the stubble burning, we all know the effect that it has on the city of Delhi. And there have been various interventions around it in terms of agricultural innovation so as to avoid the stubble burning. But and there have been technological interventions world over and in Delhi as well to ensure that we are reducing the smog. However, there could be other ways of looking at it. One is having ecological buffers, which are kind of wedded with the tree cover or what bodies. And second is to use windrows to understand what is the direction of growth that we should promote and where should we stop the city from growing or avoid that promoting growth. So I'll stop here, and I hope that there's some clues that have come to your mind.
Thank you, Ashima. We've had a great information-packed panel here. I want to thank everyone who presented for us today. And unfortunately, I think we're at the end of the time for this webinar. But if you have any questions that come up later, I know Richa has shared her email in the chat. You can always reach out to Ashima or myself, and we can pass these along to Mr. Gupta or to Kachina. So thank you so much, everyone, for attending, and I hope you can join us for our next webinar coming soon.
Thank you. Are we taking any questions and all that?
I think isn't this the end of the time? Didn't you say we have to end by 6:45?
Yeah, we do have to. Yeah, we'll not have time, unfortunately. Right. So thank you, everybody. Thanks, Amanda.
Thank you, Kachina. Thank you, Mr. CEO. Thank you, Ashima. Thank you all. Good job.
Thank you, everyone. If anybody has a question, please, you can share it with us, send it to us, and we will get back to you.
We will get back to you, yes. And we will send out a recording of this as well.
Yes.
Yeah. Thank you.
Thank you so much, everybody, for joining. Thank you. Have a great evening. Bye.